We've been working with our provincial partners in the OCNO, working on regionalizing nursing to our communities. We have 6 nursing stations and 8 communities that we provide healthcare. And so the transition, we were working on the background details, and then in July of 2022, it became our place of responsibility, and that we started working closer with our communities and the nursing staff and making sure that they were in the communities, that they're the right fit for the communities, and that there was no break in the care that was needed to be provided. So it's been a learning experience for sure, and we're happy that we're able to work with our communities to make sure they're getting the care that they need and hearing their voices. And part of the benefits of regionalizing is that we know our communities, we know the people, and the people know us, and so we understand their challenges when it comes to anything around shipping or travel in and out of a community. All of those challenges we would know about, so we're really thankful for the opportunity that we get in regionalizing of nursing supports through FNHA. So in the past year, as many people know, that the toxic drug crisis has hit many of our communities in the northern region. And so in March, we gathered together leaders and people that have had experiences with addictions to come and share their stories, hear their concerns, and put together a booklet about the concerns that were raised. We've heard many of them, but we felt it was really important to dedicate 3 days to the addictions that we face, and then understanding that one of the main things about addictions is to have empathy and compassion for those that are afflicted with addictions, that there's no family that is exempt from any kind of addictions, and it doesn't matter about the income that the person makes. They can have very little income to a high income and still be impacted in the same way. So we want people to take away that message that to see the person, not the addiction, is what we've put on our billboards, and we want to reach out to those in our communities to work with compassion at all times, meet people where they're at, help them with whatever stage, whatever request they have, understanding that maybe they're not going to succeed the first time they go to treatment. Maybe they're going to have to go again, and maybe it's going to take a few times, but we need to respond each time they ask, because that's them recognizing they need help, and that's where we step in, because people need to be ready for that. We can't make people go to treatment unless they're ready. And I should add too that from that forum, we did create a booklet that we shared at our regional caucus, where we went over all of the things that we covered that were shared. We had 1,018 comments from our community members, and so we put them together in a booklet, and then we brought that information to our communities at the regional gathering, and we'll look at what communities have said back from that report and continue to work with our communities. So in our region, we're working with setting up 3 First Nations primary care sites, and one in the Gitxsan-Wet'suwet'en, one in the Fort St. James area, and one in Chetwynd. And so each of those sites are being worked with our team from First Nations Health Northern team, working with the communities, building out the First Nations primary care centers according to the customs and protocols of that area. And so we're really excited about that. We know our people need to access health care, that they're not getting it right now. They want to attend and see somebody in a culturally safe environment. So that's what the goal is, to make sure that these centers are culturally safe, that they're going to come in and they're going to see people that they know, and in an environment that they feel safe in. I think those are really important things, and access to primary care is a key part of catching things early and making sure people are getting that care they need. Our main priority right now is working with the addictions and the toxic drug crisis that we're currently in, and hearing and working with our communities more about what we can do to help them help their people and our people, and just sending our thoughts and prayers to all of those that have been impacted through the toxic drug crisis and the loss of loved ones. And yeah, we'll get there together.